Welcome, everyone. We are excited to be part of Health Matters. This is Sarita Hudson. I'm Director of Programs and Development at the Public Health Institute of Western Massachusetts. And I'm here from the Springfield Healthy Homes Collaborative. And we have some great folks along with us to talk about lead poisoning prevention. So I want to introduce our co-panelists. So Karlos, please introduce yourself.
Good afternoon, everyone. My name is Karlos Reyes, and I am from Springfield Square One. I'm a community health worker in lead poison prevention. It certainly is a pleasure to be here. Thank you, Sarita. Thank you, Nigel and Kim, and to everyone listening. So yes, I'm happy to be here and join the discussion.
Wonderful. And Nigel, please introduce yourself.
Good day, everybody. Good day. My name is Nigel Greaves. I am the Senior Program Manager and Project Director for lead hazard prevention with the City of Springfield Office of Housing. And we are in receipt of some federal funds to help individuals and homeowners and families to abate their homes from lead paint.
Wonderful. Thank you so much, Nigel. And finally, Kimberly, please introduce yourself.
Hi, I am Kimberly. I am from the Public Health Institute of Western Mass. I provide outreach, collaboration, and promotion for 413 Cares and Springfield Healthy Homes. I'm very happy to be here, and I'm happy to be with my two sort of colleagues, Karlos and Nigel.
Wonderful. Well, thank you all for being with us today. And we have some really important information to get out to the community. The Department of Public Health has just released its 2020 report on lead poisoning in Massachusetts. And the sad news and the ongoing sad news is that Springfield is one of the high-risk communities and continues to be the high-risk community for several years. Holyoke, Westfield, and now Chicopee are also in that group of high-risk communities for childhood lead poisoning. And that they determine who are those high-risk communities by a couple of factors. One is older housing. It's because these are communities with older housing stock. Secondly, it's low income communities where there is deferred maintenance on housing. And then lastly, it's the number of children who have already been found with elevated blood lead levels or who have been poisoned. So this is something that we are working together. We're really excited to have our team here today to talk to you about all of the great efforts that are going on and the progress that's being made despite it looks like I got muted there. Anyway, so I'm going to push it on to Karlos and Nigel to say, what have you read in the report? What stood out to you in that 2020 report?
Thank you, Sarita. Nigel, if you don't mind, I'll go first. Well, you know, I think the numbers, the statistics in general, one thing that does stand out and will always stand out is just the the inequities and the race and income inequities and how children who come from different cultures or backgrounds, what have you, say Latino, Black, or what have you, are at more risk of getting lead poisoning, I should say. And that's due to where they might live or what have you. They might be in a property that hasn't been de-leaded or kept up to par. So that's one thing that I always look at. But also, you know, just the number of children that were affected, 420 children. So with 420 cases, 1,880 children were estimated to have a blood level of 5 greater or less than 5. So those numbers are definitely important. The work is far from over. It's a reminder that we have to continue to keep the conversation going, keep informing people, keep educating people, and also advocating for people as well.
Thank you, Karlos. Nigel, what stood out to you about the report?
Well, I've got to reiterate what it is that Karlos said, considering our day and age. The racial justice angle on this is just not to be ignored. The likelihood of a child being poisoned if they're Black is twice as much compared with white children. And for certain indigenous populations, it can be as much as 3 times as likely for an indigenous child to be poisoned when compared to a white child. So I'm actually doubling down on what it is that Karlos has said. This is a really important racial justice issue. And I think in 2022, coming off of our enlightening and tumultuous 2020 and 2021, it's these types of it's these types of statistics that should be centered when we're thinking about some of our public health challenges. We have similar inequities as it relates to COVID, and COVID itself has been just a tremendous burden on our society and a concern for many of our families. But those same inequities exist when you consider the impact of coronavirus. And as we have all been preoccupied with coronavirus, it continues to be a problem. Lead poisoning in our communities continues to be a problem. And in some ways, we'll see what the statistics from 2021 reveal. But throughout 2020 and 2021, families were spending more time in their homes, and it's possible that increases in poisoning could continue if that were to be the case, and if homes are not abated for the lead paint that might be present.
Right. And so I want to honor what both of you are saying. That this is a racial justice and health equity issue. And we have some strategies that we know work to prevent this. This is ultimately a very preventable issue. No child should be poisoned from lead. We've known for over 100 years that lead can poison children, and we know what the effects of that are, but we also know how to prevent it. Abatement, getting rid of the lead in homes. Lead paint is the main cause of lead poisoning, and getting rid of lead paint in the home is a strategy that we need to make universal. So first I want to talk with Karlos. What is lead poisoning? How does it impact children?
Absolutely. Great question. Thank you for that question. So lead poisoning is caused by swallowing or breathing lead. And lead poisons children, obviously, when it gets into their bodies. Poisons anyone, really, when it gets into their bodies. But more so children of ages 6 and under. And so some of the symptoms of lead poisoning can be an upset stomach. It can be trouble eating or sleeping, headaches, a change in behavior, which is usually one of the first rapid signs that a lot of families express to me. Long-term effects of lead on the body it can slowly hurt the brain, damage the kidneys, cause a lot of damage to your nervous system. It has been shown to slow down growth and development in young children, and it makes it hard to learn. It also damages their hearing and their speech, and once again, causing behavioral problems. So it's a neurotoxin, lead, and so it can stay in the body for a long time. Young kids absorb lead more easily than adults. So if you feel like if your child has these symptoms or what have you, it's very important to call the primary care physician and get tested. Again, when we discuss lead poisoning, we're looking into ages from 6 and under. And so that's pretty much the summation of what lead poisoning is. And it comes in different levels, if I might add. So when you're tested for lead poisoning, it goes numerically in terms of the level, the amount of lead that you have in your body, the blood lead level. So from 0 to 9, it's a concern, obviously. It comes out on our radar, specifically mine and everyone else's on the team, the inspector, what have you. it comes out on our radar, but legally, once it hits 10, we are to get involved and to assist and offer services. What we've been doing this year is that we've been seeing those numbers once they hit 5, anywhere between 5 to 9. For example, I'll still make a call to the family just to say, hey, this is who I am. I'm here to help you out. I've noticed, your son has a level of 7. I'd like to offer you services, do some further education with you, and and connect you with an inspector so that we can get the process going. So, this all goes back to the Mass Lead Law, Ms. Sarita. And just to remind everyone about the Massachusetts Lead Law, it states that any dwelling unit where a child under 6 years of age resides needs to be lead safe. And we know that about 71% of Massachusetts housings were built before 1978. So, lead poisoning, and I'm sorry if I'm jumping the gun, it's still prevalent. It's still a conversation piece. And as I stated, once I see a case from, level 5 to 9, I usually don't wait till it gets to 10 to make a call. It's very important to reach out and try to get those levels down and the home de-leaded as fast as possible.
Great. And that is a wonderful segue. Thank you, Karlos, for working with families. I know that must be a very scary time if you find that number is that your child, because this testing happens on a regular basis, and it's great to have somebody like Karlos to be your person to talk to and to ask questions and to support you and advocate for you as you go along. So thank you, Karlos, for that.
My pleasure.
And then I want to turn it over to Nigel to say, Nigel, how can you help? How is the city of Springfield helping folks once they find out, or if they're looking for a place to be lead safe because they're having a child or they already have young children? Tell us how you can help out. Nigel, you're on mute if you're talking.
Thanks, Sarita. So throughout Massachusetts, there are funds available for low-income families to get assistance with the cost of lead abatement. It can be pretty costly to completely de-lead a home, and it can still be somewhat costly and certainly inconvenient to do some of the minimum work for interim control to make the home safe. And so often for a full de-leading job, you might actually need to replace all of your windows at your home. And along with so many construction related costs, the cost of windows has really jumped up. And so with that being said, the state, the government in general has recognized that this can be a challenge for families when they come into whether or not they have a case of poisoning, because the goal is actually to prevent poisoning. These funds are available whether or not there's a poison case throughout the state. There's a program called Get the Lead Out that's sponsored by Mass Housing, and it's for low-income families. There are loan funds available that might need to be paid back in time. Springfield and a couple other towns in the state, Springfield is in a unique position to offer grant funding to families, to homeowners who are low income and have a child under the age of 6 years old in their home. Again, regardless of whether or not there's a poison case, grant funding that does not need to be paid back at any time, could be available if you qualify for full lead abatement at the home. And full lead abatement even includes getting brand new windows in many cases. Not in every case, but for those homes that are older, that may still have the wooden windows, the old-fashioned windows, we would upgrade to vinyl windows in order to gain compliance with the Massachusetts state lead law. That lead law is regulated by the Department of Health, by the Childhood Lead Poisoning Prevention Program, and we work in consultation with the Department of Health to ensure that all the homes that we support de-leading for and offer that funding come into compliance, that they receive a letter of compliance, what is called a letter of full de-letting compliance in most cases, to shore, sort of like a good housekeeping seal, to let you know that your home is lead safe. Now you do a lot of this work, however you might pay for it, and you get a letter of compliance. It is important to know that your home is never going to be lead free if it has had components that were painted with lead paint. Some of that lead paint is always going to remain, but it can be made lead safe through lead safe practices, lead safe construction practices. It can be made lead safe, and that would be our goal, is to certainly have as many children in our town as possible, certainly those low income, those that are a part of low income families, to be able to have a home that they live in, that they go to after school every day, that is safe for them to live and play. Children have a tendency to put things in their mouths, and if those things have any level of lead dust on them, they can be really dangerous. So we want to do everything we can to try to prevent that. And we've got funds available that can help if financing is a deterrent or a barrier. We want to see if we can work with families to get over that hump.
So Nigel, that is a wonderful offer. So I want to just reiterate, this is free funding from the city of Springfield, from their lead hazard reduction program. Nigel, what's the number people will call can call to find out more about that?
Sure, you call 413 in the city of Springfield. You would call 413-787-6500. 787-6500, and you can ask for anyone who's working on the lead program. There are a few of us in the office that are really knowledgeable about what it is. Everyone else in the office knows what it is, and can direct you in the right direction. And we'd be glad to help you kind of work on the intake process, which does include an application. The application will call for some documentation from the applicant. The homeowner will be the applicant. And so if there are tenants listening here and you are concerned about the potential for lead paint in the home where you live, where your children live, you would certainly need to speak with the landlord eventually. You could call our office and have a good conversation with us, but the landlord does need to be the one who applies for the funding because they are the homeowner. But our goal would be to have everyone work together to try to get that application submitted and approved, so that we can begin working on the home to make it safe. I'd also offer one point of clarification. There are free funds available. These grant funds are available for single family owner occupants. If you live in the home and you own the home and it's a single family home, that's when we can work with you to provide the grant funding. If you are a tenant or if you're a homeowner and you happen to own a multifamily home, a 2-family home, 3 or 4 units in the home, we would be offering the funds to you with a forgivable loan. We would put a lien on the home, but that loan would be forgiven, and that mortgage and that lien would be released after 3 years of staying in compliance with the program regulations. And that's just a matter of recognizing that when the home has rental units as a part of it, the landlord is in position to make some money off of having this work done. And so from the value of the home, from the increased marketability of the rental units. And so, we would want to just stay attached to that landlord for a little bit of time to be sure that, we're playing by the rules throughout the duration of the 3 years. But after 3 years, that lien is released and that mortgage would be amended and let go of by the city. And the lead abatement work will have been completed, and that letter of compliance would still be good after 3 years. So I wanted to offer that level of clarification related to who the occupants are in the home. But the free funds, the grant funds, are certainly right there, available for single family owner occupants.
Right. Wonderful. Thank you for the clarification, Nigel. I think it's important for people to understand that. But if you're a renter, if you are a renter with small children, you have the right to live in safe and healthy housing. So any landlord should have already done lead abatement in a rental property. This is the law. And so if you want to, you can check on the Department of Public Health's website to see whether or not that property has in fact had a lead inspection, and whether or not the property is lead safe. And if there is not one, that is something that you can request, because the landlord has the duty and responsibility to provide that safe housing. One of the things that we see here is, because there is such limited affordable housing, is that sometimes there are landlords that discourage people with young children, or people who are pregnant or looking to start a family. They discourage them from renting their property because they haven't done the lead abatement that is required by law. And I think the group, if you find yourself in that situation, Massachusetts Fair Housing Center can provide services. But just so you know, as a renter, this is something that is required. This is required by law, that all rental property is lead safe, and that you should not be discriminated against because you have young children and you need a safe and healthy place to stay. So I just want to know, are there any other final thoughts, Karlos, Nigel, Kimberly, anything else that you would like to add and share with our audience?
Yeah, one thing that comes to my mind is just making sure, safe renovations. And so what I found working with my families throughout the pandemic is that a lot of people took the time to, a lot of the free time, especially last year that we had, to, work on their homes, remodel those kitchens, do whatever projects around the house that needed to be done. And so we just want to remind everybody that when doing renovations at the home, please protect yourself and others during the renovations, making sure that the premises where you are doing the renovations are, they're nice and clean, that kids don't have access to it, making sure you're wearing gloves and safety goggles, but also making sure that the cleanup is happening. We want to remind everybody when doing safe renovations and what have you, to just wet wash all surfaces, throw out the trash, wash clothes separately, making sure that you're washing the hands, and limiting access to those areas, again, from children. And just a reminder that a lot of homes were built before 1978, as we mentioned. So debris, dust, anything of that nature, kids touch, as Nigel hinted to or pointed out earlier, and they put everything in their mouths. So we want to make sure that we're always keeping everything nice and clean, with or without renovations, Also, I just wanted to add this other fact is that sometimes, and this is with respect to other cultures and what have you, sometimes there's alternative sources to lead. An example, non-FDA approved spices that come from overseas, or maybe canned foods that come from overseas that aren't FDA approved. We find children that go on vacation with their parents, they'll come back, and then all of a sudden they have a spike in their blood lead levels. So, just these are alternative sources of lead that are out there. And sometimes it's not even paint. So just little kind of things, small things to think about as well. And like I said, I'm always available for if anyone has any questions, comments. Again, I'm over at Springfield Square 1. You can email me at kreyes@start@square1.org, and I'm more than happy to reach out. Or you can reach out to me 413-209-7608. If I don't answer, please leave a message, and I'm more than happy to return your call and answer any questions you might have.
Wonderful. Well, thank you very much, Karlos. Nigel, any last words?
Sure, I can lead off my final comments with my contact information as well, just in case folks have already picked up their pens and pads or typing on the keyboards. So you can reach me in my office. The number I gave out earlier is 413-787-6500. My email address is, you could actually email our office, and rather than reaching just me, it'll reach to our team of sort of Healthy Homes staff members, and that email address is hhinfo, as in Healthy Homes, hhinfo, AINFO, at springfieldcityhall.com. springfieldcityhall.com. hhinfo at springfieldcityhall.com. And to be clear, I am on the line today. I am speaking with all who are listening, representing the city of Springfield. But this lead poisoning problem certainly goes beyond that. And like I mentioned earlier, there are funds available for families if you happen to live outside of the city of Springfield. The terms of those agreements tend to be different, so you would have to contact your local agency. If you're in one of the surrounding towns, or in one of the nearby counties, even within Hampden County, you can speak with our colleagues at Wayfinders. Wayfinders will support some lead abatement work through their Get the Lead Out program, and that is a state-sponsored program. If you wanted to reach Wayfinders, you can contact their office at 413-233-1621, or email at homeownership@wayfinders.org. And so I just wanted to make sure that folks listening knew that the funds were not exclusive to Springfield residents or Springfield homeowners. And then secondly, as it relates to the funds that we do have here in Springfield, I'd be remiss if I didn't recognize our funder, the agency that provides the funding for Springfield to do this work. And that is the Department of Housing and Urban Development, as a part of the federal government in Washington, D.C. And this attention to lead paint poisoning prevention is one that is apparently bipartisan, and it spans many administrations, whether Democrat or Republican. Funds have been released throughout the years for different communities to do this lead abatement work. It is one of those things, one of those pieces of our societal contract that work on infrastructure. You hear that word a lot nowadays, as we add more things to the list of importance. But this lead paint issue has apparently been pretty important to our government over the course of time, and they have made funds available to communities over the course of the last many years. And so Springfield is recently in receipt of this $2.3 million grant. And the way cities receive more grant funding is by using the funds that they have. And so we would be excited to have more applicants. We encourage more applicants to at least call and inquire. And if it sounds like it can work for you, get some paperwork in. We would love to help you to get your home lead safe. And if that costs some money to do so, we are happy to help with that. So again, happy to share some of this information, and got a lot of energy behind this work, and hopefully we can help more families out over the course of the next few years.
Wonderful. And I just want to do a shout out. If you're looking for all these phone numbers, you're looking for all this information, let me give you one more website to go to: springfieldhealthyhomes.org/lead, or you can just go to springfieldhealthyhomes.org, and you'll see that lead paint is one of the Healthy Homes hazards. So check out our website. Kimberly, tell us about the Facebook page.
Yes, so our Facebook page, I'm constantly posting on resources, information in the area. With the work that I do as someone who's sort of relatively new to this in-depth work of lead prevention, lead poisoning, I really found out how much the damage there is in terms of lead poisoning and lead, exposure. So please just follow, like, and share our page. We want to share as much information as there is on lead poisoning. Please reach out to me if you have any questions or you would like training on lead poisoning. My email is K as in Kimberly, MAENDE at publichealthwm.org. If you would like training on lead poisoning for either, your staff, your children, whatever. I think Karlos wanted to say something. I'll pass it on to Karlos.
Yeah, thank you so much, Kim. I just wanted to add just a couple pieces of information before we go. In case, your child does come out with lead poisoning, a lot of, depending on the severity of it and what the child's physician says, they will prescribe, iron supplements, because we know iron helps lower the levels of lead in the body. But just in the meantime, things you can do is maintain a nice, clean, happy, healthy home, making sure that we're wiping down everything, and also just giving your kids healthy snacks, lots of greens, lots of fish, lean meat, cereals, peppers, anything that is high in vitamin C, because these things will help combat and lower the levels in the meantime. And also, just to mention briefly, just from the legal side before we go, property owners must obey the law. So if a child does get lead poisoning from their home, the owner or the landlord is responsible. If you rent your home, if you're renting your home, your landlord cannot evict you or raise your rent because of lead paint. A landlord cannot refuse to rent to you because you have children, as we mentioned earlier, even if there is lead in the home, because quite frankly, it is illegal. A landlord cannot refuse to rent to you because of your race, income, or disability. And if anyone is having problems with this or experiencing any of these type of discriminations when it comes around lead poison, you can call the Childhood Lead Poison Prevention Program. And that phone number is 1-800-532-9571, or you can visit them at mass.gov/DPH/CLPPP. Thank you.
Thank you so much to Karlos and Kimberly and to Nigel. And thank you to everyone listening. This is such an important issue. And yes, this is a racial justice and health equity issue. I want us to not forget that. This is important. So we want to advocate for more funding, like Nigel is saying that we have in Springfield, for more workers like Karlos to be out there supporting our families and to help our families address this issue and to keep our children safe and healthy, and to make sure that all of our homes are safe and healthy. So thank you very much. And thank you to Ms. Doris Harris for this opportunity to speak with folks for Health Matters. Have a great day.
Take care, everyone.
Thank you.
Okay. Stop recording now. Okay.